I'm here with Dr. Lisa Rosoff. She is currently a psychiatrist practicing here in downtown Atlanta. Um, Thank you for meeting with me today. I just wanted to get your opinion and ask you some questions on, the current U.S. healthcare system. Um, so first off, I thought, I wanted to hear what you think about, would it surprise you if I told you that roughly 28% of the U.S. population has either no or poor healthcare?
I did not know what the percentage was, but it does not surprise me.
So, well, what do you think about the current healthcare system?
I think the current healthcare system is flawed, deeply flawed, because people get insurance mostly through their employers if they work for a big company. Smaller companies can't afford to provide health insurance, and then the people that work for themselves or work for smaller companies are forced to have to pay an extraordinary amount of money to get healthcare coverage, unless they're below the poverty line, in which case they might be able to get public insurance like Medicaid.
So, then how, do you have any ideas as to, because I assume, you deal with this stuff on a daily basis or weekly basis at least, do you have any ideas on how to improve this faulty system?
I think we have to have a universal health care system that provides insurance to most, if not all, of our people residing in the United States, so that they can get preventive care and specialty care that will increase wellness overall and will decrease utilization of services by allowing people access to get treatment for conditions before they get so extreme that they require intensive care or multiple expensive medications, or they infect lots of people that has ramifications for society.
Have you, since you bring up universal healthcare, have you ever, worked in a country that deals with universal healthcare?
I have not. I've only been in Puerto Rico, which I believe is, which I wasn't a doctor when I was there, so I was a medical student, so I don't really know their system, but I imagine it's somewhat similar to ours. And so I've never worked in a country that has universal health care.
Well, since you don't, I mean, even though you still are a medical professional, but you haven't had the chance yet to work, with the universal healthcare system, do you believe that it could work in the U.S. or that it could help improve the system?
Absolutely, for the reasons that I said. If more people had adequate health care coverage, then they would get preventive care. They would not be worried about going to the doctor because it was too expensive. They would get better education and get vaccinated. We have a measles outbreak, which is threatening the country. We have tuberculosis crises. If more people had access, then they could get treatment. We would have fewer sick people. We would lose less money in lost work and wages, and overall would be beneficial across the board.
Well, thank you for your time. I only have so much time, but I appreciate you meeting with me.
You're welcome.
Thank you.
How long was that?